We have two programs, palliative care or LAVOS supportive care, and then our hospice program, Hospice of Central PA. When somebody selects hospice care, they are opting for comfort treatment rather than curative treatment.
Gil Brown, President and Chief Executive Officer, brings into focus the role of hospice care.
The most prevalent misconception about hospice care is that it's really for the last days of life. Hospice care is really intended for the last 6 months of life. So that's one. The other is that hospice is a place. It isn't. It's a philosophy of care. We care for about 210 people a day in our hospice program. Most hospice occurs in the patient's home or the place they call home. So for instance, at Hospice of Central PA, about 36% of our patients are in skilled nursing facilities or personal care homes or independent living arrangements. The vast majority of our patients are in their private residences, and we go to see them. Our nurses, our aides, our social workers, our chaplains, and our physicians all make house calls. And the number of times they go to see a patient is really determined by the patient's condition. And it's documented in a plan of care that's reviewed every 2 weeks so that we can update the frequency of visits to respond to changes in the patient's condition.
Like hospice and palliative care organizations nationwide, Hospice of Central PA is working toward bringing their care and services to communities other than the Caucasian community.
If you look at Medicare data, about 80% of all Medicare hospice recipients are Caucasian. Much smaller numbers are Latino or African American or other minority groups. Hospice of Central PA is beginning a concerted effort to understand what the barriers are to offering our services to these various communities. One of the greatest joys of working for Hospice of Central PA, in my view and in my experience, is our commitment to our mission. Our mission is to provide the highest quality of emotional, physical, and spiritual support and care to our patients. And we do that regardless of the patient and family's ability to pay. That's what a not-for-profit hospice brings to a community.